Ashley Anderson. This is task 1, putting a large dog in a cage. So I'm going to open the cage door, bring Joey in, hold this so she cannot escape while I reach in and grab the lead. Close the door and double check that it is closed. Anderson, and this is task 2, removing a large dog from the cage. So I'm going to go over here. I have obtained a leash. I have assured that it is the correct loop size for the dog, while holding my foot here so the dog cannot escape. I'll open the cage, loop the leash around, make sure it's tightened, and then take the dog out. This is task 3, putting the kitty back in the carrier. So I have her here with my opposite hand under the abdomen. I'm going to scruff her by the neck, bring her in here, release the scruff once her feet touch the carrier, put her back in, and then close the door and double check that it's closed. This is Ashley Anderson. This is task 4, removing cat from carrier. So I have Kitty here. So I'm going to open the cage door. I'm going to distract her with this hand. Then I'm going to grab her by the neck back here and carefully pull her out. And then place the opposite hand underneath her chest and then hold her against my body. This is Ashley Anderson. I'm task 5. I'm going to restrain a dog in sterile recumpancy. So I'm going to push her little rump down and then bring her forward so she's a little bit small. Then I'm going to bring it forward so that I can pull this leg out for a catheter placement. And then hold her head here. So I would hold it, then extend. This is Ashley Anderson. This is task 6, restraining a dog in lateral recumpancy. So I'm going to take her and gently lower her down. I'm going to position my hand and arm where she can't fight personnel. Restrain dog for eye medication. So we have Rufus here, so we're just gonna sit. Yes. And then I'm gonna hold him up here so that he can't, and then Lindsay is going to place the dropper in the eye while I restrain. Perfect. Ashley Anderson, I'm restraining for cephalic venipuncture. So I'm going to restrain her, pull her leg out like this, and roll off.
Oh, do you just want to start over?
No.
Oh, okay. My hands are off.
Go grab a 1cc.
this down.
It blew. Why do you have to record the whole thing?
Okay, so she withdrew and I held off. Okay, I'm Ashley Anderson. I'm going to restrain for a saphenous venipuncture, so I'm going to lay this little nugget down. You want to grab his feet? And so, almost sweeting. So holding it out like this so I can extend her leg. I know, honey. It's okay. Hey, Brandy. Brandy, can you put blood in tubes, please? Blood in tubes.
What?
Blood in tubes. Put that in the tiger. This can go in the tiger.
We need any more.
I need 1 more cc for the tiger top.
Did you throw away the?
Does that purple look okay?
Yeah, I don't see any chunkies.
Okay, and then I'm going to hold off while she pulls out. And there you go. This is Ashley Anderson, and I'm restraining a cat for a jugular venipuncture. And I'm going to hold off and apply pressure for the next 30 seconds and check it to make sure that the cat does not get a hematoma. This is Ashley Anderson, and this is task 11, applying a gauze muzzle. So I have the gauze here, and I've tied it in the first loop like you're tying a shoe. So this first part's going to go over his muzzle, and then I'm going to tie it in another loop underneath here, and then I'm going to tie it in a bow behind his ears like this. Good boy! This is Ashley Anderson. This is task 12, applying a knife muzzle to a canine. So I'm going to place it over the mouth and then flip it here like this. Task 13, and I'm Ashley Anderson applying an e-collar. So I have an e-collar, it's the appropriate size for this guy. So I'm going to wrap this around him here. And so you want it tight enough so where they can't take it off, but not too tight where it's, you know, choking them. So I'm going to clasp all the clasps here. So there's 3 total ones. Then I'm going to make sure his ear's under there, and then I'm going to pull it to make sure he can't get out of it. This is Ashley Anderson, and this is task 14. Removing a dog out of a kennel with a rabies pool. So I have my rabies pool here. So to loosen it, you just you lift this piece up, and it kind of gives you a slack. And then you pull this when you have the dog out. So I'm going to come in this cage here. I'm going to sneak the pole in here, put this over his neck, and then I'm going to tighten it around, and then I'm going to pull him out, making sure that he can't get to me and to ensure staff safety. This is task 15. I'm doing a physical exam on the dog. So the first thing I'm going to do is assess the dog from the distance. So I'm going to have Heather walk him so I can assess his gait, his overall attitude. So he looks a little nervous, but he's prancing, wagging his tail, doesn't look lame or weak on any of his limbs. His hair coat looks in pretty good condition, nice and shiny. He has a really good body score condition. I'd give it a 4 or 5. You can see the A-line. So far my first impression is that he's an anxious but happy dog. So the first thing I'm going to do is weigh him. So our scale's over here. And while Heather's walking him, I'm going to keep looking at his gait. So he is 33.3 pounds. To get the kicks, you just divide it by 2.2, and I'm going to write that in his record. So we're going to go back in here. So I'm going to go ahead and look at his perfusion factors. So the first thing I'm going to look at is his mucous membranes. So looked here, and he is pink and 2. So normal. I'm going to record this in his chart. Then the next thing I'm going to do is I'm going to listen to him. So I'm going to grab my stethoscope. And I'm going to listen at all the points of maximum intensity. So he's got a nice crisp heart rate. I don't hear any murmurs. I'm going to get a heart rate by counting how many heartbeats in 15 seconds and timesing it by 4. So he's about 100. Now I'm going to check his pulse with his heart rate to make sure that there's no pulse deficits. So for every heartbeat, I feel a pulse, so there's nice and synchronous. And I'm going to record that on the chart. I'm going to look at his respiratory rate. So obviously he's whining. So I'm going to listen to both sides of his chest to make sure that bilateral sounds are normal. Then I'm going to get his respiratory rate the same way I would the heart rate, count for 15 seconds and multiply it by 4. And he is 20. And the next thing I'm going to do is take his temperature. So, good boy. Good boy. So he is 100.1, which is normal. I'm going to record that in his chart. Alright, the next thing I'm going to do is I'm going to look at his head, I'm going to look at his eyes, his ears, look at his mouth. So, his eyes look good. He's got a tiny bit of, looks like normal aging in the eyes, so it's a little bit foggy. I'm going to look inside of his ears. So this ear obviously is wet because we just cleaned it, so that ear is nice and clean. So is this ear. His nose is good, breathing out of it. There's no discharge. There's no discharge coming from his eyes. Look at his teeth. So he's definitely got some tartar and calculus, especially in his premolar, so that's something that I would note to the owner. His gums, there's no masses underneath his tongue. I don't see any. And then look at his hard palate, and there's no masses or anything in his hard palate. His mandibular lymph nodes are small, like about pea size, and they're definitely mobile, so that's good. And I'm going to record all of that in my chart. I'm going to feel his trachea. So there's no irritation, doesn't feel narrowed. His prescapular lymph nodes, I can't really feel them. There's one right there. And then I'm going to feel for his back and his neck to see if there's any type of pain that I get from him. So if you want to just lift his rump up. So he's not giving me any sign of discomfort. Maybe right there it's a little sensitive. Okay. Record that in his chart. And then I'm gonna look back here for any ectoparasites, like any fleas or ticks, any signs of flea dirt, any scabbing, any itchiness, scales. Excuse me. I don't see any of that. Now I'm going to look at his abdomen. Oh, I know. It's okay. So his abdomen's soft. He's not reacting to any pain. His bladder's small. I can feel his colon and his intestines, and there's nothing that feels hard. Nothing that's giving him any type of pain. Up here I can feel the kidney up here on his left. I think I feel over here on the right, but I'm not sure. So he's not responding to anything being painful, so that's good. Now I'm going to look at his rear end. So I'm going to lift his tail up, see if there's any fistulas, any discharge, any odor. So it looks good. Don't really see anything abnormal there. It's clean back there. Inspect his prepuce to see if there's any discharge, any sensitivity. I don't see anything there. No masses. I'm gonna check his nails. So his nails are a little long, so I would recommend the owner get them clipped. But I don't see any scuffing. No hot spots on his toes. He's let me flex his joints without giving me any issues on this side. And I'll look at this one. Again, able to flex and extend his joints here. He's not giving me any sign of discomfort. His paw pads look good. signs of scuffing, no masses, no areas of sensitivity. Let me move his legs. Same for this one. Let me move around. Thank you. And the last thing I'm going to look is for his lymph nodes back here. His popliteal. So I can feel the one on the right side is a little bit more dominant than the one on the right side, but it's still small, it's still movable. He's got good muscle mass, good tone, no signs of atrophy. Both sides look pretty even bilaterally. So I would go over these findings with my doctor, and that's it. This is Ashley Anderson. I'm going to do TPR and auscultation on a cat. So the first thing, I'm going to look at him from a distance, and I'm going to assess his general attitude and mental status. So he looks pretty stressed out. He's got some wide eyes, but he's bright, he's alert, he's trying to get away, and he's not just laying here sleeping. As far as his gait, he seems to have good tone on his legs. We really don't have an area in our clinic to kind of let them run around, but from what we've seen so far, he's able to stand, he's able to walk. He looks pretty good as far as body condition. You know, he's a little thin, but he's not in no means emaciated, so I'd give him a 4 out of 10. So the first thing I'm going to do is get a weight, so we'll go ahead and put him on a scale. I'll have Stephanie put him on here. So he's 4.3 kgs, so I'm going to put that in my chart. I'm going to look at his mucous membranes and his cap refill. So he's a little pale, you can see that here, and he's about 1 second perfusion. The next thing I'm going to do is I'm going to write this down. Pale, 1 second. I'm going to listen to his heart rate. I'm going to do the 3 points of maximum intensity, so I'm going to start on the left side. And then I'm going to go down here on this left side. You can see where my stethoscope is. And then I'm going to go on the right side over here. His heart's beating really fast, so it's normal for a cat. To get the heart rate, you count for 15 seconds and times it by 4. So it's going to be 28 times 4. I didn't hear a murmur. It was nice, crisp heart sounds, just really fast. So I'm also going to listen to his heart and make sure I feel a pulse for every heartbeat. Which I do, so there's no pulse deficits. I'm going to record that on my chart. I'm going to listen to all the lung fields and get a respiratory rate, and the respiratory rate's the same as heart rate. You count 15 seconds and multiply it by 4. And I'm going to do all 4 areas of the chest. So everything sounds equal bilaterally, no cackles. So we have a respiratory rate of 42. And the last thing I'm going to do is take his temperature. So with Stephanie holding him, I'm just going to take a quick temp. Let me see. is 101.7, so 101.7. So that's how you do a TPR and listen to the cat. This is Ashley Anderson. I'm doing an ECG. So I have my patient that's anesthetized here. So my assistant here is restraining him in right lateral recumbency. He is under anesthesia, so there's not really a lot of restraint. So the purpose of an EEG is to measure the electrical impulses of the heart, to check for arrhythmias and things like that. So I have my 3 leads here. The white lead is going to be on the right side here. The black lead is going to be placed over here on the opposite elbow. And then the red lead is going to be connected to the stifle here. I'm going to spray it with alcohol. So his legs are parallel to each other here, and he is in lateral recumbency. And then you can see on the monitor here that the ECG is picking up. So we have the P wave, the QRS complex, and the T wave. So it's normal sinus rhythm here with a heart rate of 53. And that's it. This is Ashley Anderson, and this is task 18, venipuncture on a sphalectomy. It's a spouser. So I have my assistant here holding off. She is going to roll the vein. I have my syringe here, my tubes. I'm going to spray with alcohol while stabilizing the vein with my finger. I'm going to pop the cap off the syringe, insert it double side up. And then I'm going to pull out while Amanda places it on, so we just get hematoma. You can see I have 0.5 mL in here. I'm going to invert it into the tube. The vacuum doesn't want to work. I'm inverting it, and then I'm going to label it and date it with the patient's name. And I'm going to do cephalic venipuncture on a cat. So I'm just going to put the little area here. Then I'm going to wet it with alcohol. So I'm going to insert the needle.
I'm going for telemetry right now. Where do your clippers go? Sure, Ashley.
And my parents going to hold off with their thumb as I pull out. So I have 0.5 mL here. We're doing a blood glucose, so we're just going to stick it directly in the glucometer. If I was going to put it in a tube, I'd stick the needle in the tube. I'd stick the needle in the tube and then just let the vacuum tainer suck it in.
Oh, just kidding. But you want them on telemetry, right? Like monitoring? Okay.
So if I was doing it in a tube, I would take this off, take the needle, allow the vacuum to suck it in, and then I would label and date the tube. But we were just doing the glucometer, a blood glucose for her. Okay, so to put it in the tube, I'm just going to stick it in, let the vacuum tainer take it, which is a smaller gauge needle, so it's going to be slow. And then when there's sufficient enough sample, I'm going to take it out, and then I'm going to label the tube with the cat's name and the date. So this cat's name is Frisky Collins. I have a I would label it Frisky Collins and then the date. There it is. Today's the 6th. There we go.
All right.
This is task 20, jugular venipuncture on a dog. So I have my tube here, my alcohol and my needle. Heather's holding him off. So you can see his vessels right here. So I'm going to spray it with alcohol. I'm going to insert the needle bevel side up.
Certain promo codes based on the amount that you spend. So if you come in,
and pull like this. Then Heather's gonna hold him off so she doesn't get a hematoma. So I have the blood here, and it's going to go into the vacutainer like this. Once it's done, because it's an EDTA tube, I'm going to invert it several times. Then I'm going to label it with the patient's name and the date. So this is Rufus
is there like
Anderson, and today is the 7th. This is Ashley Anderson. I'm going to do venipuncture on a lateral saphenous. So I'm just going to clip a small area so I can visualize where the vessel is. So I can see the vessel here. I'm going to spray it with alcohol. And with Katie holding off, I'm going to insert the needle bevel side up into the vessel, stabilizing it with my thumb. And I'm going to gently pull back. And then Katie's gonna hold it to put pressure on it. You can see I have the minimum of 5 cc's in the syringe, and then I'm going to place it in the vacuum cleaner tube to allow it to go in without pushing the plunger. It's just going slowly, but it's going. Then I'm going to label it with the patient's name and the date. Napoleon Green, and today is the 2nd. Okay, you good? This is Ashley Anderson, and I'm going to do medial saphenous venipuncture on a kitty. So I have here, area was already clipped prior, so the first thing I'm going to do is I'm going to clean it with alcohol. Lauren's holding off on it and putting pressure on it. I'm going to palpate the vessel. Then I'm going to insert the needle bevel side up into the vessel. vacuum tank container to fill the tube up. And I'm going to label it with the cat's name and the date. Ashley Anderson. I'm going to do cystocentesis on a female dog. So I have my 2 assistants here. We're going to do it in lateral because she just had back surgery. I have my supplies. I have my sterile red top tube. I have 22.5-inch needles and a syringe. First thing I'm going to do is kind of palpate where her bladder is. I can feel it right here, and it's pretty large. I'm just going to do an ultrasound guided, so I'm going to prep the area first with alcohol. Then I'm going to try to find it on the ultrasound. There it is right there. So it's a nice big size. And so where my ultrasound probe is, I'm going to insert the needle at a 45-degree angle all the way through. And then I'm going to pull back. And I don't see any, so without redirecting, I'm going to pull back out. And I'm going to switch needles. You have to press it in. There you go. So you have to press it in like that. And Lindsay's going to hold it for me. So I'm going to go directly in here. And pull back. And then I'm going to pull back here like that. So you can see that I have the urine here. I'm going to sterilely put it into a red top tube and allow the vacuum to take it up. Then I'm going to label it. And because we're sending it out for culture, it's going to be longer than 30 minutes that they're going to pick it up, and I'm going to refrigerate it. So I'm going to go over here and label it with the dog's name. Just Coco, and then today's date. Thank you.